Start.
Good morning class and welcome to our channel Brothers with Care. So today we will begin our Nursing Foundation book and today our topic is Introduction to Health and Illness. So we will be explaining topic wise. Some topics will be explained by me and some by Akash. So today let's start with what is health. So most people think that health means absence of disease or sickness. Following this, we tend to ignore that other possibilities are there, like physical well-being, mental well-being, and social well-being. So, health is not just merely the absence of disease or sickness; it also means total, complete physical, mental, and social well-being. So, let's see. Health is an active process, continuous activity where a person tries to reach his or maximum potential, the highest ability. So health is a continuous process, it doesn't stop like that. It's a continuous activity where the person is trying to reach the maximum potential possible. So let me give you an example. Suppose a person is not having a fever, so we can't term him as he is totally healthy. He may be mentally weak, he may be feeling lonely or deprived. So we need to see all these aspects before terming him as healthy. So the definition. The most important definition of health according to World Health Organization. So as we all know, World Health Organization is a very large organization researching continuously. So according to them, health is a state of complete physical, mental and social well-being and not just merely the absence of any disease or weakness. So let's start the chapter with other topics. So let's move to factors influencing health. So now we will know about what are the factors that influence one's health. First is income and social status. So as we all know, money are very important aspects of our life. So how does money affects our health? So having adequate money will make us have many commodities. So having money we can get proper hospital facilities, we can eat proper food, do not starve and skip the meals. So social status and income is playing a very important role here. Better housing, better healthcare, better food. These are the basic things that comes under this. Then comes education. And what does education give us? Awareness, which is really important for health. If we will not be aware of things, like certain things, that suppose someone is having fever and we are just saying that it will be cured by the next day and not taking any step for it, it can turn into other problems or it can manifest into other clinical problems. Next is physical environment. Under physical environment, it comes the clean water, how is the surrounding, how is the availability of food, how if the area is pollution free or not. All these are coming under physical environment. So having a better physical environment promises good health. Next we have social support networks. As I said earlier, health doesn't completely mean the absence of disease only. It needs also mental stability and healthiness. So if you have a supportive family and friends, your mental peace will be there. You can share things with others that will make you calm down. So basically, social support networks give you the freedom to talk out your things and you won't suffer from loneliness. Next, we will move to Maslow's hierarchy of needs. So who was Maslow? Abraham Maslow. So he gave the human needs into motivational theory, where all the needs of human beings are arranged in a form of pyramid. The most important are put on a base, and the once one need is completed, we move to the other need. It's a pyramid like this with 5 steps, and there are certain levels like level 1, 2, 3, 4, 5. You can't just skip to the 5th level without completing a level 1 or level 3. Now let's see what comes under them. So level 1. Under level 1, it's physiological needs. Physiological needs mean water, air, then your sleep, temperature balance, basic survival needs. Like it's said in dialogue, roti kapda makan. You can't just move to level 2 without fulfilling all this roti kapda makan. So let's see what comes under this, and let me tell you, this is one of the most important topic of our chapter. So you need to thoroughly make notes according to this. Needs like air, water, shelter, body, temperature, breathing. There will be many things mentioned in your book. You don't need to go through everything. You can just make out point wise for better understanding. So this comes under the level 1, which is the base. So next there is the level 2 of Maslow's hierarchy needs. In level 2 we have safety and security. So after all the physiological needs are fulfilled, we need safety and security, the sense of safeness. So under this it will come like personal safety, that I am safe from getting robbed or physical harm. Financial safety, your financial gains that are safe. These are very much needed for your own safety as well your psychological safety. Then we have level 3, as you can see, love and belongingness. Then comes the part where we want to get loved by others, from family, from friends, from affairs, relationships. So under this, people need to get the feeling of care from others. Then comes level 4, which is self-esteem. Under self-esteem, we want to get respect, isn't it? Like everyone wants respect in life. With money, there is respect as well. If you are not getting respect, it won't even matter to you as well. People crave for it. So it comes as a level 4, self-esteem. Once you get respect, you will be feeling confident about yourself. It will raise your confidence. Then value, you will get recognized in a society. And final, there comes the level 5, self-actualization. Now what does self-actualization mean? Self means me, I, and actualization means realization. Means one gets to know his true potential. One raises to his true potential. Suppose you like painting, or suppose you are into sports. You actualized it, you realized it, and practice more harder, and one day you went for country level or international level cricket. This is self-actualization, reaching your full potential. A student who has talent in sports can work very hard, play hard, and represent his country one day. So these are the 5 levels of Maslow's hierarchy needs. So I conclude my lesson today. Thank you.
Good evening, my name is Akash Das. Today I am going to teach you about these 4 topics: concept of health, types of illness, illness behavior, and impact of illness on health. As you all know about what is health, health is a state of complete physical, mental and social well-being, and not merely in the absence of infirmity, disease or infirmity. So now we are going to know what is concept of health. So there are many concepts behind health. First concept is biomedical concept. Traditionally, we know that health has been considered as absence of disease, or if someone is free from disease. This concept is called as biomedical concept. Means if a person is not ill or having any disease, we think that he is good and he is good, he is healthy. But in health definition, we know that health is not just about physical, health is also social and mental well-being also. So this theory is completely wrong, and this theory is come from germ theory of the disease. Second, ecological concept. The deficiencies of biomedical concept give rise to the ecological concept. The ecologist put forward the concept of ecological concept. So what is in ecological concept? In ecologist think that health is just a dynamic equilibrium, and the disease is a maladjustment of the human organism to environment. And after that is psychological concept. So what is psychological concept? In psychological concept, we know that health is not just about biological, biomedical phenomena. Health is also influenced by social, political, economical factors. We can learn about that how these factors can affect the health of an individual. This is in psychological concept. After that is holistic concept. So what it is in holistic concept? Holistic concept model is a synthesis of all above the model. Means you can see that biomedical concept, ecological concept, psychological concept, they all together and make the holistic concept. In holistic concept, health is defined as a multi-dimensional process. Means health has many factors like social. The modern health definition also like that health is a state of complete physical, mental and social well-being. They also, health is a multi-dimensional process. After that, we can learn about what is illness. Illness. So now we are going to learn about what is illness. So as you can know that what is illness? And illness is the response of a person to a disease. Means when we are having fever, what is the symptoms of fever? You know that shivering or weakness or imbalanced nutrition, loss of appetite, means anorexia, that's happened to us. So it is the response. Illness means the response of a person to a disease. And due to this illness, our normal function level is changed, which is compared if we compare to the previous level. And there are mainly two types of illness in our textbook. First, acute illness. Second, chronic illness. So, what is acute illness? Acute illness means the illness which lasts relatively short time and has a rapid onset of symptoms. Means it has two characters. First, it has rapid onset of symptom. And second, it lasts relatively short time. But for the chronic illness, it lasts more than 6 months. And the second characteristic is it has slow onset of syndrome. The acute illness sometimes they are not life-threatening, but the chronic illness can be life-threatening. Like we can know about cancer. Cancer is also a chronic illness, or HIV. This is also can be called as chronic illness. So then we will learn about the characteristics of chronic illness. Due to the chronic illness, a person's bodily function is permanently changed. Second, it requires long-term care. And third, it requires special patient education, because you know that it stays more than 6 months. So a patient psychology, you can know that time what will happen to him. He or she will be more stressed or more anxiety will begin to start in his mind. So we have to provide psychological support to the patient. So we have to also provide patient education to the patient. We also have to provide education to that patient. So now I will go with illness behavior. There are 5 stages in illness behavior. First, experiencing symptoms. In this stage, a individual can realize his symptoms. Means it is the first indication of illness. Second is assuming the secret. Symptoms that in this stage a person seek validation of this experience to others and assumes a secret. In this stage, person more focused on his bodily functions and symptoms. In this stage also a person Also, a person may not do nothing or go to a over-the-counter medication shop to purchase a medication or seeks help from the healthcare provider. And in this stage, if that person is going to a healthcare provider for seeking help, he become a patient and enter the next stage, what that is assuming dependent role. So what is assuming dependent role? The stage is characterized by the patient decision of to accept the diagnosis and follow the prescribed treatment plan. Means in this stage, a patient accept the diagnosis what that physician told him and go through the and go with the treatment plan that the patient physician is telling him. So for many persons it is difficult because if that person is diagnosed with a disease, so that person have to go through a treatment plan, and then that treatment plan will not allow him to do as he want. So it is sometimes become more traveling for some people. After that is achieving recovery and rehabilitation. Achieving recovery and rehabilitation starts when the patient is in the hospital and it is finished in the home. For most of the people, it is finished in the home, and after proper treatment and education, that patient become normal and work normal activities and do normal activities.
So now we will start with the topic impact of illness on patient and family. So as we all know that illness not only affects the patient who is suffering from it, but also his family or her family members. So let's divide it into parts. First is impact on patient. So as we divided the term of health as physical, mental, social, well-being, similarly, the impacts will also, the disease will also impact the areas like physical, social, psychological, economic parts. So first is physical. Next is, according to our book, so the impacts will be first of all in physical, then psychological, then social, so we will first of all arrange this like this. So how will it impact our physically? How will it impact us physically? So as we all know, illness not only causes discomfort but gives us weakness, pain, other problems. Like someone suffering will not be able to move, immobility. These are the impacts related to physical. Then we have psychological impact. Now it will give him pain, he will be affected psychologically. He will be suffering from anxiety, depression, fatigue and other things. For example, we can say patient can feel themselves as burden to others, especially his or her family, because their family is also suffering because of them. They have to work continuously for him or her, arranging things. So at a time period that psychological thinking develops, that they are being a burden to their family. Then we have social impact. So illness can cause isolation, like you are isolated in a room because you can't move or you are suffering from something. Suppose you are fractured, so you are bedridden. So this is causing a psychological social impact on you. For example, we can say someone is having tuberculosis, so he is completely isolated either in hospital or in his own room. So he is socially isolated. This is the impact socially. Then there is economic impact. Under economic impact, as we all know, diseases not only causes all these impacts, but main is the economical impact as well. Like someone is hospitalized in a private hospital, so it will going to cost him lot of money for the cure. Not only hospitalization, even if doctors come at home for checkup, they charge money for visit, they charge money for medications. So these four are the impacts that's gonna cause of this. Now we will move to impact of family. How family members are gonna get impacted. So এটা কই? So now we will see how one's illness affects one's family. Impact on family. First of all, it won't give them any physical effect because they are not suffering from the disease. So what can it do? It's psychological impact first. Then social impact. And third is economic impact. So it's really easy to memorize it because you just have to remember the patient part and your family part will automatically be done, as family won't suffer from the physiological impact. So first is psychological, or you can say emotional impact. So if someone's son or daughter is ill, suffering, so it's common that other family members will feel sad for him, depressed for him. They can feel anger, guilt, or fear of losing the patient. The main part of emotional and psychological impact is fear of losing the patient. For example, for a mother, if the child is having asthma, so the child is having breathing problems, this will obviously create an anxiety and fear among the mother. Then we have social impact, family roles and routine changes. Suppose your father used to work for you, now he is ill, so he won't be able to do the works for the family as he used to do. So now the roles will be taken by either his older son or other family members. So it's creating a social impact. Then we have economic impact. So it's common in everything. So economic impact, once again, it's monetary. So the higher medical bills, one might not be able to afford it. They will have to work extra to afford the cost. For example, in case of major surgery, families spend lakhs of rupees for the surgery. So these are the impacts on family, patient family. And there is also health impact on caregivers. Sometimes caregivers like nurses, doctors, or other technicians may ignore their own health while giving care to others. For example, and not only health professionals, your person who is giving you care at home is also a caregiver. Like if son is ill and mother is giving care, then she is also the caregiver. So suppose a wife is taking care of her bedridden husband. So through continuous
Start.
so let's take an example of a wife whose husband is bedridden. So she will have to constantly care for him, provide him everything that he needs. So constant strains can lead to backache, back pain and other problems. So these are the impacts of patient.
Impact.
So finally, these are all the impacts of illness on patient and family. So final notes, illness is not just about the patient's disease, it has a chain reaction that affects the patient physically, mentally, socially, economically. You should always remember these four terms: physical, social, economical and psychological. And also the family's emotions, roles, finances and health. As nurse, our role is to support both the patient and family, support the patient and also their family members with holistic care. So that's the end of the chapter, Introduction to Health and Illness. We have covered all the important topics that generally come in exam. So that's it. Thank you.